New tonight, state lawmakers this week received notice that California will require a $3.4 billion loan to cover expenses for Medi-Cal, which more than 15 million Californians are enrolled in.
Some state Republicans are now calling on the governor to cut Medi-Cal access to undocumented residents, which they say has led to this need for a bailout.
CBS 8's Richard Allen is here to explain. Richard?
Marcella, that's right. Medi-Cal is California's version of the federal Medicaid program, providing free or low-cost health coverage to low-income and other eligible residents, regardless of their immigration status. The state is now borrowing billions to cover cost overruns in the program. And while some state Republicans are pointing to Medi-Cal's expansion to undocumented immigrants, the governor is saying not so fast.
It's only going to get worse.
Republican Assemblymember Carl DeMaio says that this $3.4 billion loan taken out by the state to cover outstanding expenses for Medi-Cal is just the beginning.
This is only the first of many loans that will have to be made as long as we continue to give free taxpayer-funded handouts for health care to illegal immigrants.
The Department of Finances said that the state will pay an estimated $9.5 billion to provide Medi-Cal to undocumented immigrants, $8.4 billion of which comes from the state's general fund. Originally, the state had projected $6 billion would be needed.
It has now pushed the Medi-Cal system for the neediest Californians to the brink of bankruptcy. Medi-Cal officially is insolvent.
DeMaio is calling on the governor to immediately suspend the availability of Medi-Cal to undocumented immigrants.
We cannot afford it. We should not be providing it. We have needy Californians that are now being put at risk. Their health care coverage is now being put at risk.
It has nothing to do with the undocumented population. But he always likes to scapegoat them.
Immigrant rights activist Enrique Morona says this threat to eliminate health coverage for undocumented immigrants will make them fearful to seek medical care even when they need it, which down the road could put a strain on emergency rooms, leading to even higher costs.
There's a lot of immigrants right now that are so scared.
In a statement, the governor's office told CBS 8 that this need for additional funding to support Medi-Cal is not new, adding rising Medicaid costs are a national challenge, affecting both red and blue states alike. This is not unique to California.
Governor Newsom would blame Mr. Magoo for this problem if he thought he could get away with it. He's a liar. He's mismanaged the program. He's put the health care of low-income families at risk in this state, and he needs to be held accountable.
And the governor's office also points to Pennsylvania, New York, and Indiana as states like California experiencing similar issues with funding their Medicaid programs.
So a lot of layers here, Richard. Does the governor's office acknowledge that some of these increased costs to Medi-Cal stem from expanding eligibility to all residents, regardless of their immigration status?
Well, they say that's one of many factors, but they point to a lot of them, including increased enrollment during the pandemic, also our aging population. A lot of people are living longer. And also just the general cost of health care is going up, especially prescriptions and hospital care, and that's all adding to the increased cost of Medi-Cal.
And a large portion of Medi-Cal's funding, it comes from Medicare, from the federal government. Is that federal money being used to pay for undocumented migrants' care?
That is a great question. I mean, under the Trump administration, even under the Biden administration, that was not the case. Federal law restricts funds from being used for undocumented immigrants. So in a word, no. Federal Medicaid funds are not used to cover Medi-Cal. State funds are used for undocumented immigrants here in the state of California.
So California's budget is covering the complete.
That's right, and most of it is coming out of our general fund.
This blew up this week. We're going to hear a lot more.
Absolutely, more to come.
Yeah.